medical education has been a long-standing system of teaching students how to treat disease. And what has been lacking is how to prevent the disease from establishing itself, taking hold, and needing to be treated. So while every disease can't be prevented, many of the chronic diseases that really plague the people in the United States, all over the world, can be prevented with certain measures like lifestyle choices, interventions, some societal interventions, access to the right types of healthy nutrition and exercise. And we haven't learned about that really much at all in medical school historically. And many med schools now are just starting to, and some have been, the past 5 to 10 years, getting much more focused on teaching those aspects of how nutrition and exercise, social interconnectedness, really these pillars of lifestyle medicine, can and should be used, because there's great evidence that they can improve people's lives, reduce their disease burden before they become diseased, reverse disease once it comes on, and really give people healthier, longer lives. I think I was into lifestyle medicine before lifestyle medicine was a was a topic. I was that kid who, way back in the days, I'm going to date myself here, into the 70s, when I would turn on PBS to watch Sesame Street. There was Lilius Yoga, who came on before Sesame Street, and my mom would come in and find me doing yoga with the lady on TV before I started with my ABCs on Sesame Street. So I think exercise has been a part of my life before medicine was a part of my life, and being an active person through many years, exercise, dance, sports were always a piece of what I did. And I thought that they were separate from my interest in science and my desire to be a physician. And starting medical school, I thought I went in thinking I would go into obstetrics and gynecology and really focus on women's health, including exercise, nutrition, for maximizing women's health. And it ended up that I loved neuro rehab and sports medicine, so I took a pivot and became a physical medicine and rehabilitation specialist, subspecializing in sports medicine. And that sports and exercise piece then really blossomed, and I thought, wow, there's a lot that I already know and love from my life in healthy living and exercise that informs the way that I'm talking to my patients now. And when I became aware of the American Academy of Lifestyle Medicine, or the American College of Lifestyle Medicine is what it's called, ACLM, I thought, oh, this is a formal way to get more evidence-based research and information that I can give my patients about this use of nutrition, exercise, sleep, healthy sleep, to really reduce the burden of disease, whether it's hypertension causing strokes and preventing secondary strokes, or reducing the amount of pain people have in their joints because they're carrying more weight, or because they have more inflammation. Even in a healthy weight person, having more inflammation in their body can increase their joint pain. And while I'm very good at doing injections and the types of things that we have in standard medicine, I love being able to advise my patients on, hey, if you don't want another injection, here are some things that we can do. Or if you don't want an injection at all, here are some other things that we could do to help. And so it was really a natural fit for me. And people who know me think, of course, this is what you do in your life. You were doing it before, and it became a natural fit. Though it didn't seem like it was a clear pathway, I saw them as two different things. And they ended up coming together, and I think making a career that really gives me joy, because it incorporates the things that I like to do outside of medicine, bringing it into medicine. Yeah, I think I was always advising people on exercise anyways, but I've formalized it. And actually there are, but not everybody has that as a background, right? I was a dancer, and I actually worked as a fitness instructor, and I lived for a year at a vegetarian health and fitness resort before I went to medical school, where I was working in between college and medical school. So I had, again, a life of information that was grounded in nutrition and exercise. Most physicians don't have that. That's not a standard story of becoming a doctor, is I lived and worked at a health and fitness resort for a year before I became a doctor. So for those that don't have that background, they may not have the years and years of training and knowledge, but there are now fantastic pathways like the American College of Lifestyle Medicine and other medical education groups that are putting out this information with the evidence that's grounded in scientific inquiry and discovery. Yes, time, time, time. Nobody has it, right? So it's very difficult when you're seeing a full panel of patients and trying to do some teaching at a university hospital. We always teach as well. There's really a small amount of time left for your own well-being and balance, for you to take care of your own lifestyle medicine, let alone to learn something new. But I think if it's really important, especially in an academic medical center where we are charged with staying up to date and staying educated, that people can choose to say, all right, the next 2 years, I'm going to focus on my CME coming from a lifestyle medicine bank of CME. And that way you can work it in. You can go to conferences. There's online training. There's synchronous and asynchronous ways that you can get this information. So also knowing who in your institution is doing it, because our cancer surgeons may or may not choose to go into deep dive with lifestyle medicine. That may or may not be their bag, but many of their patients are going to say, how do I prevent this cancer from coming back? Or what can I tell my family about preventing them getting this cancer that I had, if now we know it might run in our family? And while they may not have the answers, if they know, hey, we have lifestyle medicine doctors who can help you figure that out, our integrative medicine section, or our folks in sports medicine, or we're even hoping to start this in nephrology and cardiology and our primary care clinics. So we will have resources, if it's not your thing, but your patients need it, to be able to refer to it within your own system.